Another day, another story. Cardiac system overview. 1. The cardiac system, also known as the cardiovascular system, is responsible for circulating blood throughout the body. 2. It consists of the heart, blood vessels, arteries, veins, and capillaries, and blood. The heart. 1. The heart is a muscular organ located in the chest cavity, slightly to the left. 2. It has 4 chambers, 2 atria, left and right, and 2 ventricles, left and right. 3. The atria receive blood, while the ventricles pump blood. 4. The right side of the heart receives deoxygenated blood from the body and pumps it to the lungs for oxygenation. 5. The left side of the heart receives oxygenated blood from the lungs and pumps it to the rest of the body. Blood vessels. 1. Arteries carry oxygenated blood away from the heart to the body's tissues and organs. 2. Veins carry deoxygenated blood back to the heart. 3. Capillaries are tiny, thin-walled vessels that connect arteries and veins. 3. They allow for the exchange of nutrients, oxygen, and waste products between blood and tissues. Blood. 1. Blood is a fluid connective tissue composed of plasma, liquid component, red blood cells, carry oxygen, white blood cells, immune function, and platelets, help with blood clotting. Cardiac cycle. 1. The cardiac cycle is the sequence of events that occur during one heartbeat. 2. It consists of diastole, relaxation phase, and systole, contraction phase, of the heart chambers. Blood pressure. 1. Blood pressure is the force of blood pushing against the walls of arteries. 2. It is typically measured in millimeters of mercury, mmHg, and expressed as systolic pressure over diastolic pressure, for example, 120/80ths of a millimeter Hg. 3. Systolic pressure is the pressure during heartbeats, while diastolic pressure is the pressure when the heart is at rest. Cardiac conduction system. 1. The heart's rhythm is controlled by a specialized system of cells that generate electrical signals. 2. The sinoatrial, SA, node, located in the right atrium, is the natural pacemaker of the heart. 3. Electrical impulses travel through the atria, stimulating them to contract, and then to the atrioventricular, AV, node. 4. From the AV node, the impulses travel to the ventricles, causing them to contract and pump blood. Common cardiovascular conditions. 1. Heart disease, including coronary artery disease. 2. Hypertension, high blood pressure. 3. Heart failure. 4. Arrhythmias, irregular heartbeats. 5. Stroke. These notes provide a basic overview of the cardiac system. Thanks for watching.